in technologies that arise from the research from the partner healthcare institutions. Bob Langer comes up with the greatest invention in the world. If we're not involved, we'll invest in Polaris to invest in that company. Our fund is really trying to take these opportunities that are probably a little bit early or need a little bit more work or something else and make them into commercializable opportunities from our institutions. Since we focus only on partners, we don't then subspecialize and say, okay, we're only going to do therapeutics or we're only going to do diagnostics or IT. Whatever it is, if there's IP coming out of one of our institutions, that is something that we could potentially invest in. The other piece that's important is it doesn't have to be exclusively our IP. While many great inventions come out of partners, every great invention doesn't come out of partners, and sometimes it's good to have marry our IP up with somebody else's IP to make an even stronger startup. We have two different kinds of investments that we make. One is a more traditional investment in a startup, and another is an investment in technology, and I'll talk about the differences between those in a minute. And the fund was first put together in 2007. We really got moving in 2008. So it's been, if you imagine the financial markets in 2008-09, it was a really interesting time to be launching a fund. But so far our results are good. And of the 35 million, we've invested about 11 million. And a little too early for a seed fund to have a lot of exits at this point, but we can say that we put in 11 million and other people have invested over $175 million into those companies. So at least some serious people with some serious money thought that these were reasonable opportunities and worth investing in. Our goals are really two. Goal number one is we have to have a return on our fund. This is an investment fund, and we're expected to have a return. The other goal, number one, is to impact healthcare, and we have to make sure that whatever deal we do satisfies both of those goals. We have two different kinds of investments that we make. The first kind is an equity investment. So it's an investment into a company. Preferred stock would look like a traditional venture capital fund would make into a company. We reserve for follow-on investments like any fund would. So those are really actually pretty typical investments that you think of. The one thing that's probably different about us than just about anyone else is that we have conflict of interest guidelines. So, for example, if there's clinical research going on at one of our hospitals, then we're not allowed to own equity in a company that's doing clinical research at one of our hospitals. But if you're not allowed to own equity, that makes it really hard to invest in the company. So we tend to have to find a different path for those companies. We'll help them get launched, but we can't be investors and participate in the company. The second type of investment that we do, which is more common among academic institutions, we call them development investments. And that's where we're investing into a technology, where somebody will meet with us and say, okay, here's my idea, and I've talked to 5 pharmaceutical companies. If we only had this tox study done, then somebody would be interested in licensing it. And so we'll do our diligence, and we'll talk to those 5 pharmaceutical companies and find out, if that